Well, Harris County Public Health says more people here are using dangerous drugs. They're overdosing and they're being hospitalized, with recent data showing a major and concerning increase. KPRC2's Joy Addison joining us now for a breakdown. Joy, what are they seeing exactly?
Well, Danny, I spoke with a parent and a drug counselor who says what we're seeing is an issue that's mainly affecting high schoolers and their families. I took a deep dive into this public health report to break down the data for our viewers, and we've seen a more than 70% increase in substance-involved death and healthcare visits in recent years, and the biggest group affected is teenagers.
As a young kid, of course, prior to using right here, that was him being the ring bearer at my sister-in-law's wedding.
Dennis remembers the day he realized his teenage son was struggling with a drug addiction.
At the time this came out, he was almost 15, and of course it was happening for approximately 18 months earlier to 2 years earlier. He hit it fairly well, and the next day I started looking into help.
What were your initial thoughts when you first gained insight that he was struggling with an addiction?
My first thought was, I call it my animal brain. How could he do this? We're a loving family. Where did he learn this from?
Harris County Public Health says social media makes drugs easy to find for teens. A new report shows a major increase in substance-involved deaths and healthcare visits. From 2018 to 2022, we've seen nearly 74% more deaths related to substance abuse. And youth between ages 15 and 19 years old have the highest rates.
He did have a friend some years ago that had passed that he had used with. That was one of the hardest things, was to see my son go through that guilt and that pain and the shame.
The report also says fentanyl, which is commonly found in the pills teens are easily finding through social media, is causing most of these overdose deaths and hospitalizations, followed by cocaine and methamphetamine.
The other trend that we're seeing a lot is drugs being sold represented as pharmaceutical medication that's actually pressed pills that are being made in warehouses around Houston. We're seeing fentanyl oftentimes mixed in these pressed pills because it's cheap.
George Youngblood runs Teen and Family Services Recovery Center. He says the teens don't usually know what's actually in the pills and contributing to the rising hospitalizations and overdoses in our area.
Even kids that don't know that they're abusing fentanyl, we may give them a drug test when we're doing an assessment, and fentanyl shows up on the drug test, and it surprises them as much as it surprises anybody else.
Well, Harris County Public Health says it does have a plan to tackle this problem with new initiatives that include Narcan training, which is a nasal spray that stops overdoses, as well as peer recovery work through centers like Teen and Family Services that allows teens that have finished drug recovery to help other teens that are using or experimenting with these dangerous drugs. Live in the newsroom, Joy Addison, KPRC 2 News.